and the members of Lakeland Public Television. Thank you. Closed captioning for Lakeland Currents is supported by the Minnesota Department of Commerce, Telecommunications Access Minnesota, and Nisswa Tax Service. Nisswa Tax Service, tax preparation for businesses and individuals. Across from City Hall in Nisswa and online at nisswatax.com.
Hello again, everybody, and welcome to Lakeland Currents. We're glad you're with us this evening, where we're going to talk about H1N1. I guess everyone's talking about it, but we're going to be visiting with experts here to give you some really good information about how to deal with this. We're going to start our show out again this evening with a piece by Annie Cook and one of our guests. Now, we might not be able to see that. We live? Okay. I guess we didn't have that piece that came out all right, so we'll just go ahead without it. I'd like to introduce this evening three people who are working on the front lines of the H1N1 issue. Joyce Mueller is the public health nurse from Crow Wing County Community Services Health Division.
Yes.
Joyce has been working with emergency planning for 6 years and is the main contact for disease prevention and control at the county level. She has been collaborating with local hospitals, clinics, law enforcement, and schools and the Minnesota Department of Health regarding the novel H1N1 influenza virus. Dr. Pamela Master is a Central District epidemiologist, no R in that, sorry, Minnesota Department of Health, Infectious Disease Epidemiology, Prevention and Control Division. And Dr. LeMaster works with 14 counties in central Minnesota in the areas of infectious disease surveillance, prevention, and control. She has been working with local partners in their response to the current pandemic of H1N1, novel influenza. Dr. Peter Henry is the medical advisor for the Crow Wing County Public Health, and the medical director of emergency services at the St. Joseph's Medical Center. He's been involved in a countywide collaborative effort to prepare H1N1 as a member of the Brainerd Lakes Health. I'd like to welcome you all here. Thank you for taking the time out to be on the show. And as we were mentioning before we came on air, this is happening so fast. There's new developments almost every day, isn't there? There's something's going on. But maybe before we get into the specifics of the disease itself, we could talk a little bit about how your organizations work together. Dr. LeMaster, maybe we could start with you. And what is it you do as an epidemiologist?
Well, as I mentioned in the introduction there, that I do work with the 14 counties in the Central District. The state, Minnesota Department of Health, is divided into 8 districts throughout the state. And this particular district, which includes Crow Wing County and 13 other counties, are the ones that I am involved with. And again, as it relates to a lot of the reportable diseases in the state of Minnesota, many of which are infectious in nature, and so we work a lot then with the local partners. We're kind of a conduit between our central office in St. Paul and the local partners. So work quite closely with local public health at each of the county levels, and schools, daycares, all sorts of community groups, as well as community members as well.
I understand that the package is ready. We got it working. Is that correct, Mary? So let's go ahead and take a look at that, and we'll come back and carry on this conversation.
These people are protecting themselves against seasonal influenza, and many of them will be returning in a month or so to receive their H1N1 vaccination.
We are anticipating our first shipment of the vaccine late to October to early November.
The county expects to receive 8,000 doses, and it already has a game plan to get those vaccines out to their targeted populations in the community. The first clinic will be at Forest View Middle School in early November.
We want to focus on the school-aged population. And that's exactly why we're holding the clinics at the school, because it is the best place to catch those kids.
Much like the seasonal flu, H1N1 comes with a high fever and a cough, but the two strains of influenza come at different times of year.
This time of year is not the time of year that we usually get our seasonal influenzas. This time of year would likely be the H1N1.
In addition to the vaccine, there are some easy ways to keep yourself from getting the flu. First of all, keep your hands clean. If you feel that you're going to sneeze or cough, use your elbow or use a tissue.
If you do catch something and have a high fever, contact your physician within 48 hours.
You may be able to be prescribed an antiviral, which will reduce the severity of the illness and also reduce the length of the illness.
But if it's been a couple days and you haven't had trouble breathing, your best bet is to treat it like any other flu. Stay at home with rest and fluids.
There are times when a doctor visit is necessary. There are times when an ER visit is necessary. But for most of us, we're going to recover just fine. Just stay at home, get some rest, and take in plenty of fluids.
So when those H1N1 doses come in, face the needle and improve your chances of staying flu-free this fall. For Lakeland News at 10, I'm Annie Cook.
Welcome back. Joyce Mueller is the person who was on that piece. So Joyce, a nice job, even though you didn't get to see it in the studio.
That's right.
It came out very well, I can guarantee you that. Dr. Henry, what is the relationship between Brainerd Medical Health and the State Department? How do your two organizations work together on issues like H1N1?
In this particular instance, I became involved because I'm the medical advisor for the Crow Wing County, but I'm also the emergency department director. And when all of this came about and we were planning, it seemed like a logical person to sit as the medical member of this, along with public health. But it's important to note that this has really been a collaborative effort, not between just St. Joseph's Medical Center and Brainerd Medical Campus, but we've also had a partnership in this with Kaino Regional Medical Center and Central Lakes Clinic. So this has really been a county-wide effort along with the county health department in trying to plan for the H1N1 virus and influenza and the potential of a pandemic.
And how about Brainerd, the Crow Wing County Health Department? How do you interact with what he just explained, but with the Department of Health itself too?
Right. Well, you know, Pam and I work a lot together with pertussis or whatever we're finding in the community. If something is happening, I call her and she kind of walks me through what needs to be done. She also will call me if there's someone in the community who has a disease, and we kind of collaborate on, okay, how can we educate the public about this situation? H1N1 brought some challenges for us because it's a big project, and we collaborate very well with the hospitals and clinics in our area, and we've been very impressed with how they come to the table and they're willing to give whatever it takes to combat the issue. So we're working on this issue. We're looking at vaccinating people. We're looking at how can the hospitals and clinics work together to make sure that people are served if they are ill. We just have been talking about a lot of different things and coming up with plans to deal with the situation.
When this whole collaborative effort came about, there were a number of people. That's our Crow Wing County Disaster Management, our Emergency Medical Director, the County Administrator, the Public Health, many of the members of our medical staff, as well as the Kaino Regional Medical Center and Central Lakes Clinic and Brainerd Medical Campus, got together, and there's our infectious disease people. We have people that are in management. That we have people that are a part of our plant, our actual power plants and maintenance and central supply there. I mean, this has been a very expansive effort by a lot of people to try to prepare for this. And I think that really speaks highly of the people in this community,
right,
in this county.
And actually, I wanted to say too that because this is such an unusual situation that we are currently in, With the Department of Health, we do work closely with the Centers for Disease Control and Prevention, who oversees things on a national as well as international level. They're oftentimes involved in a lot of the efforts. And so we work closely with them and then in turn work with our community partners. So, we could not do it without those partners that we have in each of the counties. So it really is a collaborative effort, and we do really appreciate those efforts of everyone involved.
I remember a few years ago, the bird flu was really a concern worldwide. And because the world is shrinking and we have airplanes going to just about every part of the world, these flus, when they've been identified, it's been very quickly, because I think this was found in Mexico probably last summer, wasn't it? Or maybe in the spring?
In the spring, yes.
And this is a full-scale pandemic now,
Yes.
I think, because defined by the World Health Organization as a full scale. And is this mutating? Can it change, or is it going to be a seasonal thing, do you think, and it'll be over in the season?
Well, that's one of the things with the influenza viruses, is that it is very unpredictable. So we do want to keep an eye on this very closely. And you're correct, H5N1, which was the avian flu or bird flu that people kind of was in the media more several years back, was kind of the one that they were really watching. But then this came all of a sudden out of the blue, a novel influenza, and started in Mexico. And around this past spring, March, April is when we were starting to hear about cases coming up. But because of the flu's unpredictable nature, the virus itself, that is one reason why we really do want to keep an eye on it, because there is that possibility that it could mutate. In the current situation, it hasn't yet, as they've continued to monitor, but they will continue to monitor throughout. And when you reach pandemic level, basically, that means you have to have several things to actually have it be qualified as a pandemic, which is that you have a novel influenza virus, a novel virus, which is new, where people don't have, or they have little to no immunity to it. And it's something that can infect people and cause them to be sick. And also that it spreads easily person to person, which this particular one does, because to be pandemic obviously needs to be, it means that it is worldwide, so it is being experienced across the globe.
I believe the first shots, or the nasal spray, is arriving in parts of the country this week. Is it here? Is it in Minnesota, the spray?
Yes, we do have some. We have some in Crow Wing County. We have minimal amounts of doses of that vaccine available. We're targeting at this point healthcare workers, and in both hospitals. We're looking at emergency services workers, and so that is who we're using the vaccine for. Once we do start getting our injectable vaccine in, then we'll start looking at who else will be able to receive this. Pregnant women, new parents, of infants less than 6 months of age, and some of those groups can then be included.
I know I heard that, I think around September 24th, that a 6-year-old healthy young boy had died from this in Minnesota. Is that something that you would see in a normal season? Would there be some healthy people that do die from influenza?
Yeah, and I can take it if you... But influenza is not necessarily going to be a mild disease. I think people tend to have that reaction that it is something that is mild, but because there are oftentimes groups that are identified as being at higher risk for developing some of the more serious complications and even dying from it. But because of the unpredictability of this particular virus, we don't know specifically who those people might be. So it can, in fact, have someone who is otherwise healthy, no underlying conditions, can experience more complications and even die from it. So, which is one of the reasons why we really try to promote any prevention efforts towards it.
I think it's very important to understand that the young people who die from this disease typically die from bacterial infections as the primary cause of their death, not truly the influenza. That infection sets up a bacterial infection, and most of these young children are dying of pneumonia. Pneumonia, currently, the ones that they're having are bacteria that we recommend routine immunizations for, Haemophilus influenza and pneumococcal, and that's recommended by public health and American Academy of Pediatrics, American Academy of Family Physicians, that they routinely immunize their children against those particular bacteria. That will decrease your child's risk of developing the complications of influenza, particularly pneumonia, that is the highest risk of death when you contract these diseases.
Who are the groups right now that are most at risk?
Well, they're looking at pregnant women, new parents, so parents of new infants that are younger than 6 months of age because they are too young to receive the vaccine, but you want to prevent them from getting the influenza. Children 6 months through 5 years of age, they are at particularly high risk of developing and developing complications as a result of the influenza. So that is another group that we're looking at. Who am I forgetting?
Yeah, and aside from parents as well of infants up to the age of 6 months, caregivers for them as well.
Yes.
We're also looking at healthcare and emergency services personnel as being at a higher risk, particularly for this particular virus. As well as Joyce mentioned, some youth, 6 months up to the age of 24 years are in the high-risk category, and then people 25 years to 64 years of age with some underlying chronic medical conditions are kind of the wider group that we're looking at again for this H1N1 novel influenza. And then, as Joyce alluded to, when the vaccine isn't maybe as readily available as we'd like it to be, we maybe put some more, kind of target those groups a little bit more to which are the ones that really need to get that vaccine first.
Right, yes.
The distribution of that vaccine as it becomes available, we're going by guidelines that are provided for us by the Minnesota Department of Health and the CDC as to whom they feel should be targeted first. This isn't typically decided on a facility basis. It's based on guidelines that are coming from the state. And obviously they want to immunize the caregivers, because if all the caregivers are not able to come to work and then other people get sick, they want to target that first, then the highest risk groups, and move beyond it. They hope that there will be, and I'm quite sure that there estimated numbers that there will be enough vaccine, but it's not here all, and it's going to be coming out in allotments as they get more and more vaccine available.
Right.
Now, it's my understanding that the nasal spray is given to people who have normal immunity systems. Is there any concern about that spray with people, contact people to people?
No, you know, it's given to people 2 years of age through the age of 49, and they must be healthy individuals, so no chronic medical conditions such as asthma, kidney disease, and those kinds of things. There is no danger of someone getting the influenza from being exposed to someone who's had the vaccine. The only situation where they are looking at not recommending it is for a caregiver of someone who is isolated. So maybe someone who's just recently had a bone marrow transplant, or some of those, you know, like chemotherapy. If they're in isolation, they should not be near someone who has recently had the flu mist. And, you know, all of our hospitals and clinics, they are all aware of that, and so they'll make recommendations to their staff, such as if they are caring for someone like that in that category, they would not be taking the nasal mist.
Now, as this particular virus is starting to circulate, we still have, I would guess, our traditional flu viruses in the area. This is kind of becoming flu season. What does somebody do if they're starting to get sick? Do they need to be concerned to distinguish the two, or what are the recommendations for people when they're not feeling well?
I think the key message we've tried to do as a county and a healthcare community is to be uniform in what we're telling people, and that was part of the initial planning, that all the facilities that were involved, that we would give the same message and try to educate people that the great majority of people who contract this illness do not need to be seen by a physician. They should stay home. They should do what they are been told to do for many years when they get the flu. Provide themselves with plenty of hydration, liquids, use appropriate medicines for symptom relief, Tylenol and ibuprofen if they don't have any contraindications to taking those medications. And the key issue is if they show unusual symptoms of illness, severe fever, severe listlessness, lethargy, if they have severe chest pain, then they should seek medical attention. But the majority of people who have the classic symptoms of headache, sore throat, fever, cough, should stay home. People who are at higher risk, the ones we want to target, those high-risk groups are pretty much the same that they are for regular seasonal influenza, except for this particular novel influenza has a little bit higher predilection to cause severe disease in very young children and pregnant women. But if you have an underlying immune system disorder, chronic medical conditions such as diabetes, asthma, particularly lung disease, COPD, emphysema, those are the greatest risk people.
Mm-hmm. And you're correct in that this week is actually the first week in our regular season of flu. So as we anticipate those cases increasing, typically, in November, December, it peaks usually around February or so in the cases there. But it's going to be an interesting season in that we will be seeing probably circulating seasonal influenza along with this H1N1 novel influenza. So of course that will be of interest to see what happens. And so far, this particular novel H1N1 influenza is pretty much similar to the regular seasonal flu in its severity and in how it's transmitted, person-to-person spread through coughing, sneezing, that sort of thing. So yeah, should be an interesting season.
Mm-hmm. And I think for a lot of people there's that fear factor, and I'm sure that they feel that they should go to a doctor anyway, even though you're giving them this advice. Mm-hmm. I've seen the same advice on the national level. I'm sure it's just people's tendency to say, well, we got to go find out what this is. Mm-hmm. Can you even tell them what it is if they were to come in? Can you tell the difference between the two right away with testing, or is that a difficult process?
I can answer this because what I do for a living, I work in the emergency department. You cannot initially tell the difference. Right now, the great majority, and the statistic that I had seen was 98% of the influenza cases currently and within the last several weeks that are present are most likely novel influenza.
Wow.
We can't tell that based on a rapid test. And the difficulty with doing the rapid test, which is a nasal swab, is that its accuracy is anywhere from 10 to 60 to 70%. So if you have a negative test, it does not necessarily mean that you do not have influenza. If you get a positive test for influenza A, you may have novel or you may have regular seasonal influenza. And as seasonal influenza starts to show up in the community, then that differentiation is going to be very difficult. The only way you're going to be able to tell is if you send it off for further testing, which is expensive and not currently recommended unless you're hospitalized.
Right. At the Department of Health, that's basically the recommendations that we've been making. Initially when this started back in the spring, we did try to test everyone who was exhibiting symptoms. But as more and more cases grew, of course, and we were learning more about it, they kind of stepped back. And so now actually they are, in fact, just testing those people who have more severe disease. And again, as Dr. Henry said, most likely hospitalized cases. We do have some sentinel sites throughout the state that do submit specimens as well. We have some surveillance through schools reporting to us on influenza-like illness, and we also from long-term care facilities. So the combination kind of gives us an idea of what we're seeing throughout the state and able to identify our state as having widespread illness. And so we will continue doing that until or unless something should change in that, but that's kind of the way to keep it. But otherwise, the majority of people who have it are probably not going to be tested, and so they will not know for sure that they had it. But as Dr. Henry said, right now we're predominantly seeing the novel H1N1 influenza.
And the majority of the people who have it won't be treated either with an antiviral agent. There's a fairly specific recommendations as to who you should treat with an antiviral agent and who shouldn't. And it's primarily those high-risk individuals that we've spoken about. They're very young, the ones with chronic illnesses, those with underlying lung disorders, those who care for people who are in the higher risk groups. Well, the ones who will receive the antiviral treatment. A young, healthy individual who's 30 years of age, who has no chronic medical conditions, comes in, and even if he or she has influenza, we're not going to be treating them with an antiviral agent. We're going to recommend symptom treatment only.
What are some ways that people can protect themselves now?
I think, this is such a time to really look at some of those very basic things that we've talked about over the years. Wash your hands often, sneeze or cough into your sleeve. Be vaccinated as soon as the vaccine is available, whether it's novel H1N1 vaccine or seasonal influenza, be vaccinated. There's a number of things people can do. Stay home if you're sick. Don't be around people that are ill. Some of those very common sense sorts of things should be practiced during this flu season.
I know in church Sunday they told us to cough into our arms and not into our hands, and are sort of restricting or suggesting that we restrict shaking hands and changing that a little bit. Do you, I guess this is a broad question for anyone that wants to answer it, but do you foresee this becoming more of a problem in our world? More viruses hitting people faster because we're such a small world?
Well, of course, with all the vaccine preventable diseases, we obviously do promote the vaccinations and really do encourage people to be vaccinated. But as you said, even if we are, the U.S. is fairly well vaccinated as a population compared to others, but as you said, because of travel, it's just a plane ride away, a lot of these diseases. So that's why we have to continue to promote vaccinations and to make sure that people are doing as much as they can to try to prevent themselves from being exposed, if they are exposed to getting some of these diseases that are out there. So would always continue to promote that among people as well.
We have a.
When you talk about prevention, I don't think what Joyce had said could be stressed enough, the hand washing and contact. I've been a physician for almost 25 years. I've missed one day of work in 25 years. I'm around sick people every day of my life. I'm not a superhuman person. I don't have a great immune system any better than anyone else's. But in the 8 to 10 to 12 hours that I'm in an emergency department, I wash my hands numerous times. I consciously never bring my hands to my face without washing my hands. My children at home think I'm a germ Nazi because the only time that I typically do get a cold or I'm sick, or when my children were sick, they're little germ factories and they're spreading on the refrigerator handle and the same utensils that are used in serving food and the council and the things that I touch. And you're not quite as cautious in your own home as you are in public, but these hand sanitizers that are available, readily available, you should be using them and consciously keeping your hands away from your face. So,
we're down to the last 30 seconds. I'd like to thank you all for coming, Dr. Henry, Dr. Lemaster, Joyce. If somebody wants to get more information, is there a website or two you could give us in 10 seconds?
Through Brainerd Lakes Health.org, there's a link that can go into our flu information that's specifically designed for lay interpretation.
Okay.
Or www.flu.gov or www.health.state.mn.us.
Okay. Thank you very much. Appreciate your taking the time to be on the program. It's very helpful information.
Thank you for having us.
I'd like to tell you that in 2 weeks we will have Senator Roy Terwilliger on the program talking about what's going to happen to the Minnesota Vikings in 17 games at the Metrodome, because they have announced that they're no longer going to be there. So tune in to us in 2 weeks on Thursday Night Live. You've been watching Lakeland Currents. I'm Ray Gildow, where we talk about what you're talking about. So long until next time.
Saturday evening at 7 on Lakeland Public Television. You're watching Lakeland Public Television, providing quality programming. Programming on Lakeland Public Television is brought to you by Bemidji Medical Equipment, providing user-friendly bathing systems that help you stay clean and in your home. Information at 800-443-1292. Crow Wing Power, serving 36,000 members in the Brainerd Lakes area. A Touchstone Energy cooperative, the power of human connections. On the web at cwpower.com. Greater Lakes Performing Arts with season tickets available now. Shows at the Pequot Lakes Auditorium. Information at 568-9200 or on the web at glapa.info. And the members of Lakeland Public Television. Thank you.